Hello, my name is Siddharth Tambar. I am the physician at Chicago Arthritis. Today I am talking about treatment of rotator cuff tendonitis with platelet-rich plasma and stem cells. So what is the rotator cuff? The rotator cuff is a group of muscles and tendons that surround the shoulder joint. It provides stability to the shoulder along with the ligaments around the shoulder. The rotator cuff also provides power and control as you move your shoulder in a dynamic range of motion. So rotator cuff tendonitis is when you have injured or torn the muscles and tendons of the rotator cuff. This can be a chronic or acute process. If you've had an acute injury, you can develop a tear in the rotator cuff. Alternatively, if you have chronic stress related to chronic repetitive motion, you can also get a rotator cuff tendonitis process. Symptoms of rotator cuff tendonitis includes pain in the shoulder over the front, the back, or the side of the shoulder. Pain can move up to the neck or down to the elbow. A reduced range of motion is often seen, and weakness in the shoulder can also develop. A diagnosis is made first and foremost by a good history and clinical exam, should at least make a physician suspicious that you have a rotator cuff tendonitis process. Imaging such as MRI or ultrasound is utilized in order to specifically evaluate the degree of pathology and tendons that may be damaged. I am a significant proponent of using ultrasound, and on the right hand side you'll see a portion of the rotator cuff. That's this tissue right here, and in the insertion of this tendon, the supraspinatus tendon, there's a tear, which is this black colored area within the tendon, and that is a tear of the rotator cuff, and that is consistent with rotator cuff tendonitis as well. My general treatment recommendations as a conservative approach first and foremost for any kind of tendon related issue is first and foremost relative rest, which means reduce the activity that is causing your pain to begin with as you try to recover from your injury. Then correcting or improving your biomechanics that may have resulted in this injury to begin with. Physical therapy is very helpful in that regard. Physical therapy can also help with range of motion. It's important to keep your range of motion. As you start to lose your range of motion, that can be an indication that your tendon-related issue is getting worse. Physical therapy can also help with strengthening the muscles around the shoulder, which is also important from a long-term standpoint for treating shoulder or rotator cuff-related pain. I think it's important long-term to try to avoid anti-inflammatory medications and steroid injections. Both of those can give short-term pain relief, but are really not appropriate from a long-term treatment perspective. In addition, steroid injections have been known to potentially damage tendon and joint-related cells, and so if we can find alternative options to anti-inflammatories and steroid injections, you're better off in that regard. So for individuals who are not responding to conservative treatments alone, I recommend one of the Regenexx treatments. The Regenexx treatments are a host of platelet and stem cell related treatments that are meant to treat arthritis and tendonitis. The two treatments are the Regenexx platelet-rich plasma treatment as well as the Regenexx same-day stem cell treatment protocol. These treatments are healthy and safe for arthritis and tendonitis. They are autologous, which means that the cells come from you directly. They are used to treat your tendons, ligaments, shoulder labrum, as well as a shoulder joint. In comparison to steroid injections, which work fast but wear off quickly, these treatments take longer to work, but they give more durable and longer lasting pain relief. In addition, for some conditions, they have the ability to actually help repair damage as well. So platelet-rich plasma is a process where we take a sample of your own blood, concentrate it into a very high concentration of your own platelets, and then inject that into the tendon or joint that has been injured and requires treatment. This is a good treatment for treating tendon injuries and arthritis. It's also very good at helping to strengthen the ligaments that support the shoulder joint as well. These ligaments can get weakened if you've had an injury or stress to that shoulder chronically. Stem cells are a cell in your body that help anytime you have any kind of injury. In mild to moderate conditions, they can actually help to repair tissue damage. In more advanced cases, they can still help with pain relief. The Regenexx stem cell protocol is a 3-stage treatment protocol. It involves prolotherapy, stem cells, as well as platelet-rich plasma treatments. We use these to treat arthritis and tendonitis, and again we combine these with platelet-rich plasma and prolotherapy treatments. What are some of the results that we're seeing with the Regenexx same-day stem cell treatment protocol for rotator cuff tears or injuries, or labral injuries? What we find is that at the 1-year mark, the average improvement is approximately 70%. In addition, for people who have achieved what number of people achieve at least a 70% improvement, it's around 70% of people that have received treatment. So this is a really good indication for using the Regenexx platelet or stem cell treatments. They work well, they're relatively safe, and they're healthy for the joints and tendons long term as well. So to sum up, rotator cuff tendonitis is when you have an injury or weakness in the tendons that support your shoulder. If initial conservative management is not successful, I recommend that individuals consider the Regenexx PRP or stem cell treatment options. I do recommend that people try to avoid anti-inflammatories and steroid injections long term. Lastly, surgery, which can be utilized in some cases, really should be your last option and should not be your first option. If you have any other questions or would like to learn more, you can go to my website at chicagoarthritis.com. Thank you very much.